So that brings us to the closing remarks. We have to discuss the nerves and the blood supply. The arterial supply is from the two sources. The upper end, it is supplied by the superior laryngeal branch of the superior thyroid artery. The superior laryngeal branch, it penetrates this thyroid membrane. It penetrates the thyroid membrane and it goes and supply above the vocal cords. The inferior below the vocal cords, this infrathyroid artery, the branch of the costocervical trunk we have discussed in our head and neck lectures, and they go up to the thyroid gland. The superior one, it is related to the superior laryngeal nerve, a branch of the a branch of the vagus nerve, and the inferior one, it is related to the recurrent laryngeal nerve. So during thyroidectomies, when these arteries are to be ligated, superior and inferior thyroid arteries, there is a possibility that if the surgeon is not careful, it will lead to the ligation of the related nerves. So, if you have witnessed a thyroid surgery in person, you might know that the anesthetist makes witnesses before start of the thyroid surgery. He shows, see, the vocal cords are functioning, and then after the thyroid surgery, the surgeon makes the anesthetist a witness. See, both of the vocal cords are functioning. So no one can get some blame that the surgeon has damaged the nerve or the anesthetist has done some local damage in the larynx. So they make each other witness before and after the surgery. The venous drainage, it's just like the thyroid gland. The upper part is drained above the vocal cords to the superior thyroid veins, and the inferior part is majorly drained by the inferior thyroid veins. The larynx, again same. The upper one, the supraglottic, the upper to the vocal cords, it's going to the upper deep cervical lymph nodes. Below, it is going with the deepest to the lower deep cervical nodes. Some of them goes to the nodes in front or the lateral aspect of the larynx, known as prelaryngeal or paralaryngeal nodes. The innervation, the nerves, all of the motor supply, all of the muscles are supplied by recurrent laryngeal nerve except one muscle, that is the cricothyroid muscle. Sensory supply, the upper half of the larynx above the vocal cords, it is supplied by this nerve, the branch of the superior laryngeal nerve that is going inside. So it is the internal laryngeal nerve. And the external one was that was going to supply the cricothyroid muscle. And the nerve that is supplying all of the lower part, that is the recurrent laryngeal nerve. The recurrent laryngeal nerve on the right side was coming after turning upside below the right subclavian. On the left side, it is coming after turning upside below the arch of aorta and ligamentum arteriosum. So the right recurrent laryngeal nerve has a shorter pathway than the left one, and the left one is the one that is coming from the thorax. So for tumors and surgeries, the left recurrent laryngeal nerve is more prone to damage.